Good afternoon. I didn't want to do too loud. Good afternoon, everyone. Thank you for being here for the special meeting of the Delray Beach City Commission. May we have a roll call, please?
Commissioner Marker,
I'm here.
Deputy Vice Mayor Long is absent. Vice Mayor Cassell.
Here.
Commissioner Burns.
Here.
Mayor Carney.
Yes,
We have
here.
a quorum.
Great. We have a quorum. We have two items on this special meeting, both dealing with the opioid. In one way or another, the treatment of the settlement funds and our opioid litigation policies, et cetera, et cetera. So the first up will be Assistant City Manager Horace to regale us with his presentation.
Get up on the screen. There we go. Yes, this policy is much of what you've seen before. I'm not going to go through some of these preambles simply because you've heard them and I'm sure you don't want to hear them again. We have gone in and, as you requested, created separate trust funds for the opioid litigation fund, as well as the Karen funds, but that's not a part of this discussion.
Can I just jump in? There are segregated funds, correct?
They are segregated.
Not within the main accounts that we have just segregated on our books. I'm talking about separate bank accounts earning separate interest.
That, again, that is not the way that
Fund
we run
number.
our public funds.
Within our funds.
They are segregated for only the use for the purposes that they're intended for. Should we use them in any other way or commingle them with other funds, we would be in violation of our duty under those funds.
Okay. I'm not sure that's what I meant by the spirit of segregation, but please continue.
Just so you understand, as we're talking about annually, these are not a tremendous amount of funds. We're talking at most about the highest one is about $92,000 a year. The lowest, other than last year being 30, is somewhere about 62 or so. So it's not a gigantic amount of money we're talking about each year. Over the 18 years of the life of this program, we will get about $1.5 million. So the way the policy is designed is that we'll follow the settlement agreement, which is no later than the 30th of each year. The city will report to the Department of Children and Families of how it intends to expend monies into the upcoming year. This has been a topic in the past. The state has just created their electronic system for both submitting these plans as well as submitting your expenditures from prior years. Just got those up and running this past September when we first started talking about this. So we are plugged in with them. We know what we need to do. We have a list in our policy about the acceptable use. This is the list directly out of Schedule B of the settlement. It's very specific about the sort of things we can spend money on. I sort of I put some of the things in here, but basically I can summarize them by telling you it really comes down to two things. It comes down to we can help with treatment or we can help through education and or training. The only thing that's a little odd, there's a couple little things towards the end that are a little different. Let's see if we can do the other strategies, first responders, again, it allows us to do.
Sorry, it was my house, so I'm going to, I hate to say I'm going to delete them, but I'm going to silence them, so. Sorry, go ahead.
It allows for some training of first responders, some leadership and planning coordination, which really isn't in our wheelhouse. What those things are described specifically in the agreement. Some training and some research. Again, we're not going to be involved in that type of training or research. Some of our partners may, we don't know. Moving into the future may be something we want to put forward, but probably not, because we're talking about more academic studies. One of the core strategies, however, in this is the distribution of Narcan. Narcan essentially stops an overdose dead in its tracks. That's important when I get to our next item on expenditures. So we do have that very specific list that we lifted directly from the settlement on what the uses are, and that policy contains that attachment to the settlement. One of the things that we have there, because we want to involve the community, is the establishment of an opioid settlement advisory committee, OSAC as we might call it. The city commission establishes the committee. The committee will review the needs of the community, make recommendations to the commission on how to spend that funds, which would help us go from that laundry list to a list of things that we feel are helpful for our community. I would anticipate if we had that committee, they would look through the list, say, hey, we think we should work with the treatment center to do this. The commission agrees, then you would do something, put out an RFP for the funds for who wants what's available to do this activity. The advisory committee, if you choose, may also review applications for funding from these outside agencies. We do an RFP and say, hey, we're willing to grant somebody this money. They would do the initial review and make recommendations to you, possibly score them as you may see fit, what you think is most important for those, and bring that recommendation to you for your final determination on who should be funded. We make a recommendation of the OSAC being comprised of 7 members, 1 member representing the police department, 1 representing the fire department, 1 member who's a Florida licensed mental health professional, 1 who's a Florida licensed healthcare professional, and 1 who's a Florida certified addiction professional, addiction counselor, or recovery peer specialist. And then you have 2 at-large members who are residents of the city. Those residents could be, if you choose to, any other qualification. If you want a resident who's experienced some sort of substance abuse within their family, then they could be, we can note that on an application that they have some experience dealing with that side. Whatever it is that you want specifically can be there, or you can make those your personal priorities when we're appointing members to that committee. Hopefully through this 7-member, we didn't want to make it too large, we don't have a lot of money to deal with. A 15-member committee doesn't make a lot of sense for distributing $70,000. In the establishment, it's also important to remember, if you appoint somebody who works for an organization that may apply for these funds, we would have an inherent conflict of interest, so we have to be careful about that. Annual planning, again, because the state requires us to submit our intent for the future year, we have a timeline by which they have to be and make their recommendations to you as the commission, and a timeline by which the commission has to approve something, thank you, sorry about that, has to approve that so that we can submit it in a timely manner to the state. And again, the most important thing is the city commissioner is the final determiner of what we're going to do with the funds. The committee is there to advise you, to give you some preliminary review of what you might want to spend the funds on for the upcoming year, as well as who you might want to grant funds to if that's what you want to do. You all, sitting as the commission, make the final determination on that. Again, reporting, we have certain reports we have to file with the state. By August 31st, we have to prepare and submit to the Department of Children and Families how we've spent money in the previous fiscal year. And we also have to make sure that we do that in a format that they've suggested, which is, again, as I mentioned to you about last July, they came up with an online system for us to do that. That's the format that's acceptable to them. Just a little final note here. There is an error in the written policy that I had given you, just indicating that there's one item in there about in the advisory section that should be in the city commission, which is about the final determination. And you all had also talked about using this committee for Karen funds. We did not want to commingle those in a policy. If that is something you would like us to do, we will write a separate policy for Karen funds that meets the qualifications of that settlement, as well as assigns it to the same board, so we have similar people making decisions on funds that are somewhat similar but not the same and not from the same source.
And you and I have had this conversation the other day on the distinctions with the use of proceeds as it related to both of those settlements that we've
Yes.
reached. And so we'll get there, but the policies may have to be different.
They'll be slightly different, but again, we can use a very similar process for both of them.
No, I'm just saying, there are certain things that one thing allows and the other thing doesn't contemplate.
Yes, sir. That's all I got.
Great.
At this time, it would be appropriate for the city commissioners to engage and deliberate with respect to any specific thoughts and consideration. This is a special meeting giving you all that opportunity. Of course, after this exercise, of course, the following presentation regarding proposed expenditures of opioid litigation settlement funding as of November this month will be afforded. With that, I'll yield at this time and give the commissioners an opportunity to engage.
My only point is these are kind of very similar topics to me, because they all kind of have the same ultimate goal. As I pointed out to the assistant city manager the other day, we do have within our comp plan a whole section which deals with these kinds of issues in broad terms.
Which section are you referring to?
Well, the healthy community section
Okay.
of the comp plan.
Oh, I thought you were giving me a.
No. I mean, there's different policy numbers in here, and I think that I apologize. I printed this out for myself. I didn't send it to
That's fine.
anybody. I was worried about sending anything to anybody because I'm getting in trouble. But
You don't want to get yourself in trouble.
but I'm noting it. Unfortunately, Anthea's not here. But Palm Health had a big part of drafting this component of the comp plan, and so my whole goal here is to make sure that we are achieving what the results are, what the goals were of all the different settlements that we reached, and we can discuss whether the segregated accounts are right. I mean, I'm not fighting on that issue yet, but. So I'm giving it to the commission to decide. I mean, whether or not we're really ready to appoint the board yet. And I'm not suggesting that the articulated type of expertise as it relates to the opioid settlement might be different than the other settlement. And Lynn's gone, but I had discussions earlier today about whether or not both of the policies that the city has, how do they interact with this? And the answer is they don't.
Right.
So we're kind of free to,
You have
we
capacity
have a free-form
to.
thing here to develop our own.
You do.
Our own policies.
You certainly do, and that's
So-
the basis.
With that, Commissioner Casal.
When we began discussing this, however many encounters ago, 4 or some such, I said, look, I said that I think first we should exhaust the funds that we can to our police and fire department. I know you felt slightly differently, but individuals were entitled to gain entry to that litigation. That litigation was not exclusive to municipalities. So people who lost a loved one to addiction or even had a living loved one suffering from addiction were entitled to participate in that litigation. What happened, unfortunately, as a result of that crisis was that the city incurred a tremendous amount of expenses. We added an additional firefighter to the ambulances in that period of time, which has then stayed. We had to hire additional people. So I think if we can use it, plus we are very active in our community in addressing some of these issues. Within our community, some of the funds to address the issues, and then what's left over, we figure out how we're allocating it. But again, this is like our 4th encounter. I've said it 4 times, and that's how I feel. I know what you're saying, that people lost their lives. Those people were entitled to gain entrance to the litigation on their own as well. So I do say that some of that money should go to them, but I do think we also have to cover the expenses that we incurred as a city. That's it.
Man from heaven. Okay, so Commissioner Burns.
Well, I still feel that, we have specific guidelines that we have to go by to distribute the funds. And I just think that it should benefit our residents. I mean, there's a lot of healing, there's a lot of treatment, a lot of healing that needs to be done. And I think that the first thing that we should be thinking about is our residents. I don't think there is any hurry to use the money. The hurry was to make the reporting. So if we are delayed again, I've been trying to do this for a year. It's been a year already. So I think that we should go ahead and formulate this advisory committee. It's not that hard. We have people who are qualified. We have the categories that we are working with. Go ahead and complete this so that this doesn't have to sit here another year.
Ladies and gentlemen, may I offer a reiteration? You brought up, Commissioner Burns, the piece relative to reporting. We talked about this before. We are squared away in that regard. We did have an opportunity to interface with the state of Florida regarding that matter, and given the fact that there hadn't been any expenditures to that effect, and they are really getting their gears in order to proceed with the acceptance of reporting and so forth. There's no concern imminent as it relates to the city of Delray Beach, just to be clear and for the record.
Right, so that just verifies that there's no hurry to expend the money. So we don't have to just get rid of what we have right now. As long as the reporting has been done, there's no urgency.
No, I'd rather do it right. I mean, I wish I could say that everyone in this room didn't experience somebody dying from substance abuse, but I think feel fairly safe to say somebody knows somebody here who's died of substance abuse.
Absolutely.
And I know it's a small amount of money, but it's a really important issue to a lot of people. And I just want to get it right. And I agree with Commissioner Burns. I don't want to rush to just say we're going to do this. I want to make sure that we.
But why are we having this meeting? I'm so.
Oh no, I want to come to a conclusion. I'm
Okay,
working on
because
I'm working on.
This is our fourth meeting on this subject, and as Ms. Burns said, she's been working on it much longer. At some point,
I am happy to,
we have to wrap it up.
I mean, I would ultimately like to see, and I'll be honest here, I'd like to ultimately like to see, I want to hear from Palm Health, who is like kind of an expert in this area, and as I said, substantially drafted this portion of the comp plan for the city of Delray Beach, to maybe see their thoughts as to how we could structure this thing. I'm not suggesting the board that you have set forth isn't the right approach, but we're going to need some central group that kind of understands the industry in order to make sure that the local groups get the money, because I do believe that the first line of defense, so to speak, are the local not-for-profits that deal with this with the local people. So that's really kind of where I was going with all of this. And I know we're dealing with a small amount of money, but it's a lot of money to
You're right.
Yes, sir.
to these groups.
May I ask
you
a
say it's only
question?
70,000 a year. Well, that's a lot of. I mean, you
Yeah, we're
can
not
do
trying
good
to
things with $70,000 a year.
Could I ask a question, please?
Sure.
I thought we were going to formulate a committee, was going to go out in the city, get us the organizations that qualified, bring them to us, and then we were going to hear from them.
That's what I.
I'm not terribly confident, with respect, that the city, which is not, this is not what they're principally engaged in, will get the right composition.
Are you confident that we will?
No, that's why I'm talking. I wanted to, when you talk about like the Palm Health people or a similar ilk, who have this is what they do, might have a better.
So then why are we forming a committee? I just,
Well, look, I
mean, if
we
we're forming
haven't
a
formed it
committee
yet.
and they're
If you're
deciding,
asking
then
me
we're
where I
not-
would like to go with this, I would like to go
so
with.
now we're not forming, you don't think we should form a
I
committee?
think we should. I think we should
'Cause
establish.
day
I would
one
like to.
I said we shouldn't
My
form a
goal would be
committee.
to have Palm Health come back with a presentation how they would form the local committees, how they would do. And I don't even know these people, so
I feel-
I just know them by reputation and learned today that they're the ones who drafted this.
You, but you invited them here a month ago, so somebody
No, we
knows
all did.
something.
We all did. We all.
I
said-
did not.
I
invite
think that
them.
more than Palm Health should be presenting to us. We have other
That's
professional
fine.
out in.
Right, I agree with
again, I
Ms.
said are
Burns.
similar ilk. I'm not.
Yeah.
I don't know them.
So we're gonna keep delaying,
No, I
delaying
mean,
forming a
I-
committee, and so the funds just sit and then they sit.
I'm happy to.
I mean, it's not a ton of money, but it can be used right now for doing good in the community. So I am not in favor of delaying this thing. Jeff, I think what you presented smelled right to me. The committee size seemed right. The composition seemed right. I can envision quarterly meetings, and I think we should go ahead and appoint this board and let them work with the other agencies and move this thing down the field. I've only been here for 6 months, but we've had multiple meetings on this, and I think it's time that we move this one forward and get that money back into the community work and do some good. And I know we're in no rush. I read, we can wait, but that doesn't smell right to me.
Okay, so can we discuss then, are we going, I feel, again, I'll say it, that we should give some of the money to some of the resources for our city
That's part two.
fire
That's
and police.
two. First,
Right, but if we're forming the committee, I think we need to talk, okay, fine, I'll wait till part two.
So if I may,
Okay,
ladies and gentlemen.
Right now, so if you're looking for, do we have consensus then that we're gonna follow the direction and form this committee? Is that what you want to do?
I would like to do that.
Is that what we're asking to do?
I would ask to do that, and of course, immediately after whatever consensus you achieve in that regard, let's go ahead and address the second part
Then
of
we
the
can talk about
presentation
how
so that we
wanna
can
get
come
this done.
back.
So do we have consensus to authorize the establishment of this committee? Who will be making the appointments for the committee?
Yeah, who's
The
making
commission.
appointments?
The commission will.
Okay.
Fine. I
Thank you.
think that you have consensus.
And I
to
would
go-
not, I would be The two at-large are at-large. I don't think you have to say they have to have somebody that we get to pick, so we can pick people that we feel are qualified. I think any further restrictions on that is unnecessary. Thank you.
Do you want to keep that they're city residents?
Yeah.
Yeah, city residents, but at large. And they,
Right.
the full at large. They shouldn't have to have someone die in their family to understand the importance of this issue.
Right.
I merely made the point of you could
No,
add anything
understood,
onto it that you
understood,
wished.
understood.
Yeah, less
If you
is
don't
more.
want to,
with
no
at-large
change.
Okay, so we have
restrictions.
consensus on that, right?
I'm a yes.
Yeah.
There we go.
Mayor, I did want to mention, however, also to the vice mayor's concern about the city using some of the funds. The city is extremely limited in what we may be able to do, but there's
Understood.
also nothing that prevents the committee from saying the city should use some of these funds and recommending that to you.
But we can determine that. I think what I'm saying is we should determine that and then tell the committee what we need them to determine versus vice versa.
Absolutely. Each year,
Thank
you
you.
get to make that
Right.
determination how
Thank you.
funds going to be spent.
Right.
They're merely recommending to you, so you can do
Yes.
those things if you agree that that's what you'd like to do.
Thank you.
Great. So agenda item 1 is now complete.
Woo.
Yep.
Great,
Thank you.
Jeff.
There we go. We moved
Good job.
forward. We moved,
I like moving
is good.
forward. You know how I am.
And that's the purpose of the special meeting format, ladies and gentlemen, so that you can. So let's go.
Well, now we have the consideration of proposed expenditures, which is a broader discussion.
Yeah. Let's
Thank
get
you.
to it.
That's the format to take care of first item first, as you
Well,
did. Very
we've got the committee
productive.
set. Okay.
Mr. Orris, if you would, please.
All right, Assistant City Manager Jeff Horace. Just a little bit of history here. The city, this is the same history as we had before. I don't think I need to go through this again, why we have funds available to us. Receipt of funds, of course, we'll have that separate account. At your September 9th meeting, there was a consensus given that we should look at spending the money that we have on hand right now, which is $239,554.27. That amount is burned into my brain at this point, for things that the city can do. So how did we look at what we could do? We brought in 2 representatives from the police department, 2 representatives from the fire department. We said, what are our problems? What are our issues? How can we spend this on us? We looked through the allowable expenditures in the settlement agreement, which significantly limited us. First of all, I'd also like to add that those staff members came forward and they really didn't want to spend it on stuff they had. They recognized there were limitations, but they kept wondering, how can we save people from overdose?
Right.
And so a lot of the things contained in here about how we save people from overdosing or being substantially harmful, how an overdose is substantially harmful to their future or preventing their death. So they really came together and looked at those things. They weren't really looking at what can we have. So I thought that was really good. Like I said, a limited number of projects were available. So here are some of the things we talked about. The police department, one of the things they'd like to do is restart their DARE program. This is a program
That's the first thing
that's
I
shown
heard.
to educate young people about the detriments of drug abuse and alcohol, as well as gives the police department an opportunity to identify some of our children who are at risk so they can intervene individually. Has been very successful in the past, but for various reasons, it was discontinued. It's not a high ticket item. We're talking about $8,000 to start it up with recurring costs. And we tried to stay away from anything that was going to have a recurring cost. So the idea was if it had a recurring cost, it would be something the department could absorb into their regular budget. So we were talking about one-time expenditures.
Got it.
It does have a recurring cost should additional officers be necessary, and for additional workbooks for the program, which are about $165 for 100 workbooks. The police chief did indicate he feels in the future he would be able to absorb this into his budget. The authorization, item G8 in Schedule B of the settlement, which is Exhibit A to the policy that we just talked about, specifically says that we can use funds for fund evidence-based prevention programs in schools or evidence-informed school and community education programs. I'm not going to read the whole thing, but it basically says this is a good program for us. The Struggle Well program, this is one of 2 programs we'll have in here that are about first responder wellness. And this one essentially is a program designed to ensure first responders can transform struggle into strength and post-traumatic growth. So it's a program to speak with the officers about how they deal with the traumatic events they go through, including opioid overdoses that they see on a regular basis. The cost for this program is $50,000 for an 8-hour course. This would be provided to all of the folks in the police department who experience trauma or secondary trauma associated with opioid emergency events. So the authorization is under item I-2 in the settlement agreement, Schedule B.
May I ask you, how do you, it's that 50,000 calculation, wellness training, it's an 8-hour course, is that for all qualified, that's calculation?
It's for qualified, and I do believe we included some overtime expenses so that everyone could attend.
Thank you.
A supportive gap assistance for those seeking, obtaining, or transitioning from treatment. This is basically a fund designed that we can use to help people enter into treatment or exit out and transition back to a regular day-to-day life. What police department brought forward is there are occasionally instances where we have identified people who we'd like to help get into treatment, and they can't go because they have expenses. They have to pay for their family. If they go to treatment, they won't have housing. So this allows us to work with other community groups to provide a full range of wraparound services so that if it's a single mother, we can pay for childcare so that she can attend treatment. This allows, like I said, those regular expenses that can make a huge difference to someone seeking treatment. And we regularly identify those types of people and try to give them assistance. We need to cobble it from wherever we can find it. This would be a little bit of a backup so that if there's something we can't find elsewhere, we can provide it directly.
The $20,000, how is that figured?
That would be on a case-by-case basis out of the police department of whether somebody actually needs housing so that they can attend and we can't find another source of funding for it, or childcare, or just basic food and transportation to and from.
That is per incident.
That is a $20,000 fund that we can tap into each time somebody needs
A fund,
$2,000
okay.
worth of housing.
Okay.
It's just that there'll be a lot of receipts involved.
Is that a
Okay.
recurring? Is that a?
That is not a recurring. That will be a one-time. It's something we'd love to recur, but we want to make sure we have something that we can move forward with now and help people in an immediate situation.
Okay.
The fire department has suggested a Narcan distribution at city facilities. We have Narcan in some of our defibrillator boxes, but it's not particularly noticed. So the idea is I got props for this one. A Narcan box. So these would be found in city facilities, parks, buildings, and such. Cities would install themselves. It has contained inside of it simple box of Narcan nasal spray that anybody can use. We put these, if somebody takes these from the box, that's a good thing. Take them, bring them home, have them if that's something that you feel you need around your house. That's okay. But we want to make sure that we have these at all city facilities and that they're clearly marked so that people don't die in city parks and on city property. And we all can recognize if somebody has a problem and see what we can do about initial treatment while we're waiting for the paramedics to show. We're expecting a cost of about $9,500 to purchase these. And again, city staff installing, we did not include a cost for that. It's allowed under item H1. It's also not included within all this backup there's a list of core activities that are desired under this. The distribution of Narcan, particularly to those who can't afford, but to the general public, is a core request under the settlement. So this does fit one of those number one things they want us to do, is to get Narcan out to the public.
Where does the city get Narcan from now? Like, is it, because there's a service that comes around, they give it for free. You can get as many as you want,
Yes.
so.
And what we're talking right now about is just the installation of the
I
box.
understand, I see it says the box.
I-
However,
I do not know where we're getting it right now. I can tell you the next time I'm going to talk about where we're
one of
going
the
to get it for
officers
some.
is raising her hand back there.
We get it from the Heroes Grant from DCF. So we have a grant that we get, but that's just for.
Ms. Ciancio, can you please come to the podium to state it for the record, please? Well, this is why you are here this afternoon, ma'am, so that you can contribute and offer productivity accordingly. Yes, ma'am, please. Thank you. Ariana Ciancio, ladies and gentlemen, Delray Beach Police Department.
Hi, everyone.
Everyone just calls her Ariana.
You still have to formally introduce yourself.
Ariana Ciancio, Service Population Advocate Manager at the Delray Beach Police Department. There's a HEROES grant that the city gets, and that's where we get our Narcan for FD and PD, and we have to calculate all of that Narcan. Everyone's got a little number on it, and at the end of every year, we have to give back whatever we don't use, and we get that grant every year from DCF. But that's not, so like I can't keep extra in my car and give it out to people. That's only for usage on PD and FD. That they
I
use.
see, utilized and administered by
Yes,
them.
right.
Whereas this would be for residents.
This would be for residents.
Okay, if I may, are there side effects? Is there any reason why someone, I don't know anything about
No.
it, so
They say there are no side effects.
you just
No.
think somebody's having a problem and you give it to them?
Yeah, and it
what if
doesn't
they're
work on
not
someone
having
who-
a
it doesn't
problem
work.
and they're having another problem?
It doesn't work. Yeah.
Would you mind?
That's
Because
fine.
I just, how do you just decipher if that person is having a drug issue or they just are having a heart issue or stroke or some such?
Sean Gibson, Division Chief EMS for Delray Beach Fire Rescue.
Thank you.
Basically, when Narcan is administered to somebody who has become unconscious, they're barely breathing. The side effects can be just kind of a quick wake up and then violent reaction to the drug. That's something that can happen. However, for the most part, with people, especially with these fentanyl overdoses, because fentanyl is so strong, more strong than heroin, it takes more Narcan to wake that person up than it does for people who are doing heroin. So those side effects are not as profound. And it will save the person's life because at that point, they're so neurologically depressed, they can't even function. They can't breathe.
Do we have these in schools? Like, I would say teachers
I can't
probably should have
speak to that.
access to them, but I don't know that your average resident should be,
Yeah, I can't speak to that, but I know that this is widely distributed.
I think someone else
and
has
it's
their
so
hand raised.
easy to use.
They are
that-
in schools? Okay.
Thanks, Joe. I didn't know. And a lot of our AED cabinets have them in there, and correct me if I'm wrong, but we have been teaching the city employees that they're there and that they're to use.
So we have them currently in city buildings?
We
Okay,
do.
so you were saying, I don't know if Delray Beach City should be distributing Narcan to residents. I feel like, I don't know.
I would say that to me, even cardiac arrest patients, if we have any suspicion, it's within our protocols to give Narcan because sometimes it is an overdose and we don't know it is.
Okay.
Unfortunately, people don't understand this fact that a lot of our geriatric population has polypharmacia and they take a lot of medications and they have dementia or Alzheimer's. Well, some of these people forget what they've taken and they take double doses of what they were supposed to take.
Oh, interesting.
If they have chronic arthritis or any other kind of pain management issues, sometimes they overdose on their pain medications. So we end up giving them Narcan and sometimes that works and we get them back. So that's something that we do
So you
as
would
just
feel comfortable
general
with
treatment.
this? You feel comfortable with this just being a box, being in a public place where anyone can just grab the Narcan?
I think
I'm-
so. I think that this is
Okay.
a huge public service because it kind of mitigates a lot of the risks that we take when people don't treat it. Because if you don't treat it and your brain goes without oxygen for more than 6 minutes, it starts to die.
Yeah.
And some of these overdoses are happening in places that aren't really overt.
Okay.
You know, they're underneath a bridge, they're in a
Right.
bathroom, they're in a dressing room on Atlantic Avenue, and nobody knows that they're there until somebody knocks on the door and sees feet sticking out.
Huh.
These are calls I've been on. That's why I'm saying these things.
Okay.
And Narcan's available for purchase at
It
CVS.
certainly is.
I was talking to the pharmacist
over the
about it.
counter.
Yeah.
All they have to do is walk up and
That's
ask
all
for
you
it.
gotta do.
They'll charge them for it.
Yep.
So
Well, thank
it is
you.
available.
And making the
appreciate it.
availability makes, I mean, we've had unfortunately some restaurants in town where in the bathrooms, people did
Yes.
not have access to things and died, which creates a whole
Yeah.
other,
You know,
myriad of issues.
and if someone within that community or that area, they know, hey, there's Narcan, I watched a video on it, or I got trained by somebody, then they'll know to administer it, and that person's that much further ahead. people don't understand, but the nasal mucosa is very vascular.
Okay.
So as soon as you squirt that up into the nose, the blood vessels pick that drug up and start to transport it through the body. So it's
Thanks,
bioavailable
I'm not super
immediately.
familiar. I appreciate your
Commissioner
information.
Burns?
Are there any training? I mean, I know it's simple. I was shown how to do it. It's simple,
Sure.
but do we have any time where the community is offered a training session on Narcan and how to use it?
We've done one, sorry. I would say back about a year and a half ago, Rebel Recovery, which is a harm reduction program in Palm Beach County, had gone to the Delray Beach Public Library and they did a community training for anybody. And we really targeted the businesses downtown to make sure they were all present so they knew how to use it. And then they gave out tons of Narcan. I mean, it's saving lives.
Right.
That's what it's really all about, is saving lives. And our overdoses, if we go back to 16, 17, 18, when we started carrying Narcan, I think our number may have been 78% of the overdose deaths and the overdoses that decreased from one year to the next just because we had Narcan. I mean, that's all it is now, just saving people's lives.
Thank you.
You're welcome.
I have one more question. Number 3, the supportive gap assistance. Would that be the program that you work with?
Yes, it would
Thank
be
you.
flex funds to use for
That's all.
individuals in our city who
I
need
like
help.
you know that. I like that program. Okay, that's
you.
it. Okay.
Jeff, quick question. Is the county contemplating a similar type program? Have you heard anything?
County contemplating a similar program, anyone?
No?
Not to our knowledge.
Yeah, I like this idea. I think this is great.
Along those same lines, and to what the mayor was starting to address, our next one is for Narcan distribution at businesses. We do know that we've had restaurants where people have overdosed in the restaurants, particularly in their restrooms. This also creates a liability for the restaurant. One of the things we can do is the South Florida Opioid Network has Project Opioid of South Florida, which is a nonprofit that will supply us through some of their grants, opioid, Narcan boxes such as this, that we can then turn around and have them work with the businesses to install them in businesses and train the employees. Part of the dollar figure we showed for the initial year, because we don't want to keep this going too much, is they will also have one of their folks go around, make sure the boxes are full, and replenish them as necessary.
Oh, wow.
If we don't want the recurring cost, we can make sure it's done, that we check on those cabinets when we do fire inspections. And of course, we can find a way to supply that to them or make sure they get a supply, or they can reach out to us and we can get a supply from one of those places, particularly Project Opioid, who may be able to supply it to us for free, and we just turn it over to them. I'd like to, with this program, want to start with the restaurants, and as far as we can get with that $50,000, go to as many businesses as we can. But I'd like to start with the restaurants because those are places where people stay for a period of time and congregate.
Thank you.
And again, would be a box like this that would be installed at their business if they chose to just have the Narcan elsewhere. Project Opioid has done a similar project in Fort Lauderdale. They've told us some of the businesses don't want the cabinet up, so they distribute it through different spots in their restaurant, and they train their staff to know where it is kept, so that if they see somebody in emergency, they can run to it and get to it. Again, availability of Narcan to the general public, and we have in doing it through the businesses, we actually satisfy 3 of the items under the settlement agreement. One of them, as you see there, H2, public health entities provide free naloxone to anyone in the community. Narcan is the brand name.
Thank you.
You know what? There's an item. I'm sorry. That I think we may have missed.
Number 7.
I got those. You did that.
This one. I'm sorry. This one is the substance use disorder reduction program. This is the use of I'm terrible with these names. Buprenorphine. Thank you.
That too.
Essentially what it is, it's working with the hospital district, who now has a Medicaid-assisted treatment program located in South County here. And essentially this medication is given to someone in overdose in an overdose condition. It prepares them to be transferred over to the hospital and to this program. It has shown to reduce the effects of recidivism. You're not going to find people having relapses in overdoses when this drug is administered at the time of overdose. So again, not a large expense, but something that can significantly impact the long-term effects of opioid addiction to an individual. Again, fire department saying, this is something we think will help people. We'd like to have it to be able to administer to them. And of course, this also would require us to work with some other outside entities and have those people entered into the proper programs after the administration. So we'd have to make sure that's all set up before we start to administer this drug. The last thing we have for the fire department is a International Association of Firefighters Resiliency Training Program, much like the wellness, the struggle, whatever the name was for the Struggle Well program for the police department. This is one for the fire department. It's $15,000 for a 3 consecutive day training program. One of the reasons why this is so much cheaper is we do not include overtime because we should be able to hit all the firefighters while they're on duty. Again, a one-time offering, so there's no recurring costs, and it's justifiable under item I-2 of Schedule B for the provision of wellness and support services for first responders. We have come up with a total, I'm sorry, the bottom's a little cut off there, of $158,000 worth of potential programs. We had $239,000 and change that was available. We just couldn't find other programs that fit a justification to do. We had looked at the possibility of some equipment, but it just didn't fit in the justifications, so we did not move forward with any of those. We looked at other programs. Nothing really fit in what we do in trying to help the public with these items.
Okay.
So we are through this, leaving $81,552.27 on the table, which I would assume we would just roll over into what's available for us to spend in the future.
I'm going to put, this is just the opioid settlement. This is not the Karen.
Yes, sir.
So, because we're keeping those separate. Okay, that's fine.
There is possibility in the future if you want some of these programs to recur and they are appropriate under the Karen settlement. The DARE program may be one. We could look at that in the future.
Okay. Any comments?
No, I would say thank you very much. Thank you to the people that came today from the police and fire and provided this. I love the DARE program. I'm beyond excited. Struggle Well, and of course, the supportive gap, I think, is so necessary, and I appreciate that. I'm in favor of all of these programs because I really feel like that I visualize that would be the way that the money would be used. And I'm excited to use the additional $80,000 within our community.
Commissioner Burns?
If everyone agrees.
Well, I had my deepest hope was that this money would get out into our communities as soon as possible for those organizations and professionals who are working with people who are receiving services and need them so much. I didn't even consider inside programs. However, being a teacher, the DARE program was very effective, and it does provide awareness and education for our students. So, of course, I'm for that one. And then I like the program where the support of the gap, and all of them are they're beneficial. However, yeah, I'm glad you didn't work it down and find other programs to get all of the money. Like it seemed like you were trying to spend it all. But thank you.
Mayor, if I may, we did our best to look at programs that were beneficial to the public, could be administered by us, but also, again, those things that were one time so they don't keep being funded. And the folks I worked with from police and fire did just a crack job on making sure that we had the right things and didn't overextend And we did not want to come to you with just other things that might spend the money.
Right.
We want to make sure that they were going to be helpful to the community and to our first responders.
And so these programs doesn't entail any overtime for.
As I said,
These
the
are
training,
within the regular day.
the training may involve some of that, but we accounted for it in that. None of the other programs should trip in any overtime or at least significant overtime. It would be minimal.
Okay, thank you.
Commissioner Marker.
Yeah, I think this is great. I went through a DEA training program last year, 12 weeks, and the fentanyl crisis was explained in great depth. And there's so many overdoses out there with that drug. You don't know what dose you're getting when you're taking it. And this is going to save some lives, and I'm all for this. I think this is a great program. And to your point earlier, like if a restaurant doesn't want to put this in the bathroom, I get that. But they're going to have a first aid kit somewhere in that restaurant. This can be just put on the wall right next to that.
And I should also mention, for the restaurants and other businesses, this is a voluntary program. They do not have to participate if they choose not
Yeah.
to.
Yeah, so I think this is great job. I think we should move forward on this.
So I think that I have some question as it relates to the resiliency component there, the deal with burnout, but I'm prepared to move forward this first year to go forward. So do we have consensus of the commission that we're going to agree to this? Is that what we're looking for here for the numbers
Yes.
that you've just shown? Do we have?
Yes.
Yes. We go. Well, there we go. I'm
Thank
looking
you.
forward to it. I mean, starting with the DARE program, which I think is a fabulous program, and all the other stuff. I think it's great. So
Good job, Jeff.
we got it off the table,
Good job, Jeff.
but we still got 80,000 to worry about, and we still have to talk about Karen.
So that will be a following discussion,
understand,
separate and
I
apart from
understand,
this. And if I may,
Another
ladies,
workshop.
in early 2025, I'll get together with everybody in terms of
We're having
what
a
that
workshop
looks
on
like.
December the 24th. It's 5:00.
Well, December 24th is technically a Tuesday, so that would actually work.
Oh, good. There you go.
So we have 81,000 left. How often is this fund replenished?
We get money every
Annually.
year.
Annually?
Yeah, for the
Yes,
next
ma'am.
10 years.
For the next decade, I believe it is.
Yeah,
18
16.
years, actually.
Right.
Yeah,
I know
between
that
on the
we have
decade.
21 years. I just wanted to know, it's annual. Okay.
Yes,
But we have a
ma'am.
balance here, so the numbers are going to get less as we go, because we're not going to get the same amount.
Of course.
It will fluctuate annually for the years to come. So I will be coming back to you all with other specifics via reports, other details in terms of how we execute the specifics
Something we
based
can
on the
vote
direction
Perfect.
offered.
We'll be done with it.
Nevertheless, congratulations, ladies and gentlemen. This is where we need to be, so I really appreciate the special meeting format enabling us to be productive. Otherwise, I yield at this time.
Good job, Terrence.
Great.
Thank you all for everything.
Thank you all. So